Hello and welcome. Today we're diving into the world of hereditary pancreatitis, a rare genetic disorder that affects the pancreas. We'll explore what causes it, how it develops its symptoms, and how it's managed. So, let's get started. The primary cause of hereditary pancreatitis is, as the name suggests, genetic. It's most often linked to mutations in the PRSS1 gene. This gene provides instructions for making trypsinogen, a precursor to the enzyme trypsin. Trypsin is crucial for digesting proteins in the small intestine. Other less common gene mutations like SPINK1 CFTR and CTRC can also contribute to the development of this condition. These mutations alter the normal function of trypsinogen, making it resistant to inactivation or causing it to activate prematurely within the pancreas. Okay, let's break down the pathophysiology, which is how hereditary pancreatitis affects the body. Normally, trypsinogen is activated into trypsin only in the small intestine, preventing it from digesting the pancreas itself. However, with mutations in genes like PRS1, trypsinogen can spontaneously convert to trypsin inside the pancreas. This premature activation triggers a cascade of digestive enzyme activity, leading to autodigestion. Essentially, the pancreas starts digesting itself. Over time, this chronic inflammation and damage can cause scarring, fibrosis, and eventually pancreatic insufficiency, meaning the pancreas can no longer produce enough enzymes and hormones needed for digestion and blood sugar regulation. Hereditary pancreatitis is considered a rare disease. While precise figures are difficult to obtain due to underdiagnosis and varying diagnostic criteria, it's estimated to affect roughly 1 in 300,000 individuals. The age of onset can vary greatly, with some individuals experiencing symptoms in childhood, while others may not develop problems until adulthood. It tends to affect males and females equally. Because it's a genetic condition, there's often a family history of pancreatitis or other related pancreatic disorders. The hallmark symptom of hereditary pancreatitis is recurrent episodes of abdominal pain. This pain can range from mild to severe and may last for several hours or even days. The pain is often located in the upper abdomen and can radiate to the back. Other common symptoms include nausea, vomiting, diarrhea, and weight loss, especially if pancreatic insufficiency develops. Some individuals may also experience steatorrhea, which is the excretion of excess fat in the feces due to impaired fat digestion. Diagnosing hereditary pancreatitis involves a combination of clinical evaluation, imaging studies, and genetic testing. Doctors will consider the patient's medical history, including any family history of pancreatitis. Imaging tests such as CT scans, MRI, and endoscopic ultrasound can help visualize the pancreas and identify any structural abnormalities like inflammation, cysts, or calcifications. But the definitive diagnosis is confirmed by genetic testing, which involves analyzing the patient's DNA for mutations in genes associated with hereditary pancreatitis, particularly the PRS1. While there aren't strict classifications or distinct types of hereditary pancreatitis based on the specific mutation, the severity and progression of the disease can vary significantly from person to person. Some individuals may experience infrequent and mild episodes of pancreatitis, while others may have frequent and severe attacks that lead to chronic pancreatitis and pancreatic insufficiency. Unfortunately, there is no cure for hereditary pancreatitis, so treatment focuses on managing symptoms and preventing complications. Pain management is a crucial aspect of care, and it may involve pain relievers, nerve blocks, or even surgery in severe cases. Dietary modifications, such as a low-fat diet and avoiding alcohol, are also important. For individuals with pancreatic insufficiency, enzyme replacement therapy can help improve digestion and nutrient absorption. In some cases, surgery may be necessary to remove damaged portions of the pancreas or to relieve bile duct obstruction. Since hereditary pancreatitis is caused by genetic mutations, there isn't a way to directly prevent its occurrence in individuals who inherit the gene. However, genetic counseling is important for individuals with a family history of the condition. Genetic counseling can help families understand the risk of passing on the mutated gene to their children and can provide information about prenatal testing and other reproductive options. Additionally, lifestyle modifications, such as avoiding alcohol and smoking, can help reduce the risk of triggering pancreatitis attacks. The prognosis for individuals with hereditary pancreatitis can vary. Some may experience relatively mild symptoms and infrequent attacks, while others may face significant complications, including chronic pancreatitis, pancreatic insufficiency, diabetes, and an increased risk of pancreatic cancer. Early diagnosis and management are crucial for improving outcomes. Recent research is focused on developing new therapies that target the underlying genetic defects and prevent the progression of the disease. Gene therapy and other innovative approaches hold promise for future treatments. Thank you for joining us today, and we hope this explanation has shed some light on hereditary pancreatitis.